So today's topic is models of process improvement. If anyone is joining late, please help them out with the page number. It's on page number 49 onwards. Models of process improvement. So the first model is PDCA, Schwartz cycle, Deming cycle. Okay, come out of this. Okay, regarding the other names. So think carefully, study properly. Okay, or the other names of the same model. You should know this. So plan, do, check, act. Okay, it starts with plan. Okay, you identify a problem. Okay, you make plans for it. How to make sure you find a solution. Okay, so when you are planning out a solution, okay, making a policy, making a procedure, making an SOP, making a guideline, okay, giving solutions, putting it in paper. Okay, in the planning stage, everything is in documentation form. It is not carried out yet. Okay, it is a responsibility of the top management to plan a policy, to make a procedure, to make a guideline. Okay, objectives, getting the objectives done, action plan done, everything is documentation here, everything is documented. You have a way forward. Okay, in written, in writing, you have a way forward. That is the planning phase. The second step is do. So whatever is documented, now you put it into action. Okay, so that is the implementation phase. Whatever you have wrote down, whatever solutions you have, okay, in the action phase, it is do. Giving training, giving, teaching someone, correcting someone, okay, making others aware, okay, having a control, operational control, communicating the issues, communicating your solutions. Okay, having a plan and keeping it in your pocket will not give a solution. You have to communicate it out to concerned representatives. Okay, that is the action phase. Then you have the check phase. Okay, once you have given your actions, now you look back, you sit back and see how the actions are giving you results. Is it giving you positive results or is it giving you negative results? Okay, so monitoring, analysis, taking corrective actions, taking preventive actions, doing audits. Okay, they come under the check phase. Okay, audit is also a part of check, because regularly you have to see what are the things that is lacking, where you are getting a lot of trouble. Okay, where troubleshooting has to be done. During auditing you can do it. So monitoring, analysis, corrective action, preventive action. Okay, these all are the examples of what you do in the check phase. Okay, and then the final phase is act. In the check phase, you will see a lot of changes that has taken place. Either it will be positive or negative. Either the changes are towards your objective, or maybe it is deviating away from your objective. Okay, so if it is deviating away, you have to act again. Okay, you have to review your strategy. You have to make some new strategies because your plan is not working as it is supposed to. Okay, again you will go to the plan phase, so it comes in a full circle. Okay, is it clear? PDCA cycle. Next you have Kaizen Blitz. Okay, Kaizen Blitz is, Kaizen means what? Continuous improvement. Okay, Kaizen means whatever things you do, whatever observations you do, okay, whatever actions you take, if it is towards the improvement of the present situation, you are having a Kaizen method of work. Okay, so Kaizen means what? Looking for changes, looking for continuous improvement is Kaizen. Kaizen Blitz means what? Kaizen Blitz is a small project. Okay, continuous improvement strategies, sometimes it could be big projects. It can last for more than 10 days or so. Okay, but Kaizen Blitz is not like that. Kaizen Blitz should get the work done within 10 days. Small projects. Okay, operational level projects are usually done under Kaizen Blitz. Okay, so Kaizen Blitz is a focused activity on a particular process or activity. Okay, so on a particular process or activity means what? You are not concerned in changing the entire department. Every department may have 10 to 20 processes that they do. Okay. But you are not changing 10 to 20 processes. You select one process, a one small step in that process. You focus on that. You want to improve that. Okay. Improve that area. Okay. Because it's a very small kind of study. It's a small research. It's a very small project. Within 2 to 10 days, your solution has to be ready. Your trial and error has to be ready. Okay. So that is Kaizen Blitz. So Kaizen Blitz, any operational level manager can take. You don't need the permission of the top management to approve any projects of Kaizen Blitz, because we know it's an operational level decision making. So for that, you don't have to involve the top management. Okay. So Kaizen Blitz, is it clear to all? Basically, it's just continuous improvement pertaining to small changes that you make in the department. Okay. Next you have is the PDSA cycle, Plan, Do, Study, Act. Okay, it is research oriented. Okay, PDSA is more research oriented. So the plan is the same. Okay, you describe the objective, you make predictions, you see which where change has to be done. You have a list of action steps that needs to be taken. Everything is in writing here. Again, in plan stage, everything is in writing. Nothing is conclusive. Nothing has been done. Everything is in writing. Okay, collecting the data. Okay, they all come under the plan stage. In the do stage, what happens? Since it is the research, you do the testing. Okay, run the test, observe what is happening. Okay, maybe it could be a simulation as well. So you're studying a simulation. So observation, collecting the data, running the test. Okay, giving medications if it is a clinical based trial. Okay, giving medications, any on any medicine or any treatment strategy you want to do a research. Okay, you need to run the test, which means you have to start giving the treatment or start giving the medication. This is the action phase. Then in the study phase, so study, you have to think here. uh, in PDCA it was check, but here PDSA it is study. Study means you are studying the results. Okay, you have given the medication. Now you see and observe how the patient is responding to the medication. Okay, you have collected the data. Okay, you make a statistical analysis about the data. You put the data into tables, you put the data into graph and try to find a conclusion out of it. Try to gather a conclusion out of whatever you have collected. So that is the study phase. Okay, you analyze the data, you compare the data. Okay, you compare it to the predictions that you have made in the plan stage. Okay, was your prediction proven right, or was your prediction proven wrong? Okay, make a summary, make a conclusion. Okay, make a results paragraph. That is what you do in the study phase. And finally, in the act phase, based on the results that you got from the study phase, you make a new procedure, you make a new guideline, SOP. Okay, a policy. Okay, so act is what happens next with this information, because this piece of information is valuable. Whatever you have studied is valuable. It has to be put into some or the other use. Okay, so that is the act phase. Where will you put this information into use? Okay, that is act phase. So that is about the PDSA. Is it clear to all? Is it clear to all so far? Next is rapid PDSA. So this is a trial and error kind of a strategy. Okay. You have 2 to 3 times or more than 3 times you can do a trial and error. Okay. So whatever you do as a trial and error, you test and find the result. You see what works, what does not work. When you do a trial and error kind of a situation in the hospital or in your organization, that is rapid PDSA. Okay. It is not that costly in small projects. Okay. Small relevant projects when you don't require some extra funding to do the study. Okay. You don't require any specifically trained staff to come and do this study. Okay. Just with the basic piece of pen, paper, maybe a computer Excel sheet. Okay. With that also you can do a rapid PDSA. Stepwise approach is done. Okay. So it is basically trial and error. So this is kind of a first try. It didn't give you result. You go for the second solution. That also didn't give you result. You go through the third solution. Okay, and so on. You see how many solutions you have. You check everything out. You test everything out, and what works best for your organization, you stick to it. Okay, it should not be very costly because it's a trial and error kind of a strategy. Usually, you will not invest much in these kind of projects. That is rapid PDSA. Okay. For example, in HR department and all. Okay, hiring some qualified staff. Okay, putting them into training, not hiring them but at least taking some interns, giving them some specific training and see how they interact with the client. If it is not working, giving them some other kind of training and see how the interaction goes. Still it is not giving the solution as required. Okay, so you do some trainings on interns. Okay, some presentations you take, you give them some soft skill training. It does not take much hard work, does not take much funding. Okay, and interns, you don't pay them. Usually interns work usually for free, they volunteer. Okay, so doing some training on interns, giving them some soft skills and see assessing how they interact with the customers and clients and see the reports. Okay, so that is an example of rapid PDSA. Next, we have the focus PDCA model. Okay, PDCA remains the same: plan, do, check, act. Okay, what we have discussed in the first slide, it remains the same here, but the only additional fact here is focus. Okay, focus, again, it's an abbreviation. It stands for, F stands for find a process to improve, O stands for organize a team, C for clarify any knowledge, current knowledge, U for understanding the causes, okay, and S stands for select the process improvement. So here, a hospital will have thousands of processes, okay. You find one process that you want to improve. Focus, okay. Find one process you want to improve. So take a team, okay. After finding the process where improvement has to be done, make a team of 3 to 5 members, okay, who exactly know the process. So what you have to do, you have to make a team within the department which has this process. Okay, some process in the ICU has to be improved. You can't hire staff from the OPD. You have to take the ICU staff to be a part of this process improvement model. Okay, and clarify the current knowledge of the process. See what is the current knowledge the staff or the team member has about the process. Okay, and understand what are the reasons causing trouble in this process. Okay, you can do a cause and effect diagram here. Okay, from various dimensions, what are the trouble that is coming to this process, you will identify. Okay, and you will have n number of solutions because each of the identified cause could give you a solution. Okay, but you can't apply each and every solution. Okay, any one solution you can apply because of budget constraints. Okay, so select one process improvement solution, and once you select that improvement solution, now again you will plan how will we execute it. Okay, what all things we require, what data we require to execute this solution. Then you do the solution, then you check if the solution is giving you results or not, and then you act. Okay, if it is giving you the results, make the solution into a SOP, a policy, a procedure. If the solution is not giving you results, again go back to the understanding the causes of the process variation, take another solution, put it into PDCA, okay, and it goes on and on. So this is the focus PDCA model. Is it clear to all? Is it clear to all? See, in focus PDCA, one process you have to choose. You have to work on one process at a time. Okay. You can't choose any person to work on that process. You have to choose the team. Okay. You have to make a team who knows the process well. So you have to organize a team within the department which does the process. Okay. If it is an insurance process, you can't take MRD people from the MRD department. You will not choose them. You will choose only the people who work in the insurance department. Okay. And you find with their knowledge, with their current knowledge, with your knowledge, you find out what is the reasons this process is having troubles. Okay. You will find 10 reasons that is giving the trouble in this process, but you can't find solutions to all 10 reasons and put it to work. It will be very costly. So you will pick the top 3 reasons and find a solution, one solution that will cure all the top 3 reasons. Okay. And then you do a PDCA for that solution. Okay. Next you have is a FADE model. So FADE stands for focus, analyze, develop, and execute. Okay. But each of these abbreviation, they have a variety of sub steps. Okay. For example, if you see just the focus part here, just to do the focus part, it will take you 2 to 3 days. Okay, just to do the focus part, it will take a team 2 to 3 days. Okay, in just by doing the focus step, in the first day, you will generate a list of problems that are happening in your organization or in your department. You will select one problem because you will see which problem, because of which problem you get majority of your customer related complaints. Okay, select that one problem. Okay, and put it into a proper defined statement, because before you start on into your research or study, your objective has to be very clear. Okay, your problem definition has to be very clear. It should not be vague. It should be very specific. Your objective has to be very specific, measurable, attainable, relevant. Okay, time bound. You should have that smart objective in mind. So keeping all the smart characteristics, you have to define a proper statement. Okay, if you have done research, you would know what does this step mean. Okay, formulating an objective, stating an objective. Okay, in single line, the objective should be so precise, so specific, and so relevant that it does not require further explanation. Okay, so that is the focus part. It may take 2 to 3 days. That one step will take 2 to 3 days. Okay, then you have analyze. Second step is analyze. Now your plan is ready. Your problem is ready. You know where you have to work on. Exactly within how many days, what exactly you have to collect, what exactly you have to work on based on the objective. You are clear. Okay, now in the analyze phase, it may take 1 week or so. Okay, you have to collect data. Okay, make a team, let some of the team members go and collect the data. Okay, so other team members will find out why you are getting the problem. Okay, divide the work among the team. decide what you want to know. So from the data collection, you will decide, okay, determine what are the factors that are very influential in causing any problem in the process, okay, because you have to find solutions then to eliminate those factors that are causing problems, okay. It will take you 1 week or so. It should not be more than 1 week. Within 1 week, data collection has to be done, finding the factors, finding the reasons that are giving you trouble in your process, okay, finding the reasons also has to be done by within 1 week, okay. Then you come to the develop phase, okay. In develop phase, now you know who is causing trouble, what areas in the process is causing trouble, what are the internal or external factors that are causing trouble, okay. You have data collection, you have put the data into tables, you have put the data into graph and charts, okay. And now the data speaks more information. Just by looking at the graphs, statistics, charts, okay, you get more information, okay. Based on this more information, based on the knowledge of internal and external factors, okay, you develop a good solution, okay. Not just one, you develop more than one solution, okay. And select the best solution that is feasible, that is within your budget, okay. Some solutions may be very good, but it is out of your budget, okay. You do not have the resources to put that solution into action. Maybe you may have to hire someone who will cost a lot for the organization. You may require some investment in a software or in tools or in machineries. You do not have the budget right now. So what you can do, what is the second best option, okay. So find solutions, not just one, find more solutions, okay, promising solutions, okay, and select the best solution out of them which is feasible for your organization, okay. So that development is done. Now everything is in paper. Till here, everything is in paper, okay, in writing. The what you have to do exactly in terms of solution is also there in writing. Now put those writings into action. That is executive state, okay. So execution may take weeks or months because you have to train the staff, okay. You bring new strategies, people will say no, we don't want to do this new things. People will not accept, your staff will not accept new plan, new strategies, okay. So you have to resolve the conflicts, okay, and then put the plan into execution. Make everyone on the same boat, okay. Everyone should be on the same boat while execution, okay. So you have to execute the plan. You have to gain commitment from everyone who will be a part of this plan, okay. You have to monitor the impact of the plan, okay. Once you execute the plan, the story does not end there. You have to sit and watch, okay. In paper, the solution was so good, okay, but in real life, after execution, is the solution as good as it claimed to be, okay. You will have to find that out, okay. If it is not as good, it is not giving you desired results, you will have to find some other solutions, okay. So these things execute may take weeks, okay, because you have to resolve conflicts. If there are any conflicts, you have to resolve them. It will take time. You have to teach the new tricks, new policy to the members, okay. Create awareness. In service training has to be done. It will take time, okay. So is it clear about the FADE model? In analyze phase, you collect data, okay. You have stated the objective, you stated the problem. Just by looking at the statement, you know where you have to go to collect information. You collect the data, okay. You have the data, you put the data into graph, tables, okay. You will start seeing answers. Just by putting the data into graph, you will start seeing answers, okay. And determining the influential factors means what? Causative agents, okay. Internal, it could be internal things in your organization that is creating a problem, or it could be external things, maybe your patients or law, legal things, okay, new policies, your competitors, okay, anyone could be causing a trouble within your organization. So you have to find out, is it internal or external? Both will have a solution. Okay. So collect the data, put it into table, put it into graph, put it into statistics. Okay. Gain information out of it. Okay. Just by putting a huge amounts of data into graph, into table, it is more understandable to you what is actually happening. Okay. That is analyze. Is it clear to all? Next, we have the 5S method. Sort, set in order, shine, standardize, sustain. So 5S method can be used in MRD. It can be used in housekeeping department. Okay, anywhere where cleanliness, order, okay, things get fuzzied up very quickly, things get scattered around very quickly. Any department, okay, where a lot of filing is required, a lot of categorization of items is required. Okay, in all these department, 5S technique can be used to make sure that the department will always stay organized. It looks clean. Okay, it looks error free. Okay, for that 5S technique is used. So the first is sort. Sort means you have heaps and heaps of things. Out of it, you have to sort which you require, which you don't require. Okay. Maybe you are in the MRD department. Okay. MRD department is flooded with files, medical files. Okay. You have to sort means what? All the files beyond 3 years of age. You can discard it. If it is the hospital policy, okay, inpatient files you will keep only for 3 years. Any file that is older than 3 years, you are supposed to discard it. Okay. So in sort, you discard the items you don't require. Okay, and you keep the items that you require. That's it. That is the sort step. Okay, discard that is not required. Keep that is required. Okay. Next is set in order. So now you are left with only the files that you actually require. Okay. In the past 3 years, whatever inpatients you had, how much ever inpatients you had, okay, only those files are remaining with you. But again, you have to set them in order, year wise, month wise, okay, date of admission wise, you are setting them in order. Okay, you may have 10 different shelf, each shelf for 1 year and 1 month or something like that. You can categorize, okay, and in a very orderly manner, either by date of admission or by IP number. Okay, you are keeping it in order. That is set in order. Alphabetically, it could be any strategy you can use. You can arrange the patient files alphabetically according to their name, or according to the inpatient number, according to the department in which they were admitted in. Okay, different wards in which they were admitted in. Okay, it is your calling how you want to categorize or set in order the files. Okay, next is shine. Once you have kept everything in order, you may ensure cleanliness around the shelf. Okay, the floor, the empty part of the shelf, the filled up part of the shelf, everything looks dust free, order free, clean. Unwanted things should not be there in the room at all. Okay, so a general cleanliness has to be maintained. That is shine. Okay, all aspects of your department, not just where you have done the categorization right now, not just that part, but all the other part of the department should look tip top. Okay. Next is standardized. Okay. So in standardized, whatever categorization you are following in the certain order, it could be alphabetically, IP number wise, date of admission wise, whatever category you have selected, make sure everyone follow the same standard. Every other employee in the department is aware of this order and they follow the same order. It should not be that day duty employees are following alphabetically, night duty employees are following date of admission wise, it will create a huge mess. Okay, so whatever rule you are setting here in setting order, make sure everyone follows that as a standard. Okay, and once a standard is set, once a discipline is set, okay, somebody should be there, some supervisor, manager, an authoritative figure should be there, just to overlook, okay, and improvement wherever further development is required, okay, to continue the standards, to continue the best practice, okay, to give guidance wherever required. A supervisor should be there to sustain whatever changes you have created, whatever is going well, to sustain that wellness. Okay, a supervisor, a sustainer is required. So this is the 5S technique. Is it clear to all? Then you have Muda, Mura, and Muri. Questions will come from here. These three are Japanese terms. Okay. Muda, which means anything that does not add value to the customer, or wastefulness. Whatever you are doing, or whatever products you are making or service that you are giving, it is not giving any benefit to the customer. So that is wasteful. You are wasting your resources. You are wasting the energy and time of your staff for something that does not give any value or any benefit to the customer. So that is muda, wastefulness. Okay. Pura means unevenness. Okay. For example, some staffs some staffs are working for just 5 hours a day. Other staffs are working for 8 hours a day. Okay. The way how you have planned the rotational duty shifts, it is uneven. Everyone does not have the same kind of task, even at the same job description, at the same job level. Okay. The the workload could be uneven. Some doctors and some nurses are overworked, others are not. So that is an uneven distribution. Okay. Sometimes the time and resources that you give, okay, some departments, they are under overlooked. Some departments are getting a lot more than what they require of the budget. Okay. Then Muri means overload. Usually nurses and doctors in India are overloaded with patients. The patient nurse ratio, the patient doctor ratio is like, it's very pathetic in India. Okay. One doctor for 1 doctor for 1,000 patients, one nurse for 60 patients. That is the ongoing ratio. Okay. So it is already, the ratio is in such a way that staffs will definitely be overburdened. Okay. By the sheer amount of work they have to do, to the population that they have to tend, it is an uneven workload. It is an overload of work. That is Muri. Okay. These are the three Japanese terminologies. You should know this. Next you have is the lean waste. Lean waste, we have discussed it many times. Okay. Downtime, you can remember the mnemonic called downtime. With that, you can remember. There are 8 lean waste. Okay. If you do anything in the organization to remove any of this one waste, whatever you do, if it is removing any of this one waste, if it is giving solution to get rid of any of this one waste, it means you are doing a lean project. Okay. So first is defects, errors. Okay. Giving the wrong treatment, sentinel events, near miss events, medication errors, hospital acquired infections. Okay. They all are defects from a healthcare perspective. These all are defects. Okay. Next, overproduction, giving more than or making more than supply is more than demand. Okay. It will lead to wastefulness. Okay. Manufacturing more drugs than what is actually required by the population. Okay, it will just sit on the shelf and expire. So that's a waste. Waiting time. Okay, customers are waiting for long hours to get a service done, usually in CT and MRI department. Okay, waiting time ranges from 2 hours to 4 hours and all. Long waiting time. That's a wastefulness of the patient's resources. Then N stands for non-utilized talent. Overskilled staffs are given simple works. Okay, a staff who's trained in critical care, if she is put in OPD department for work, you are undermining her skill. Okay, you're not using her certified skill. Then transportation. From warehouse you have ordered something, once it reaches the hospital you send it back, it is no longer required. Okay, so transportation waste, loading unloading resources that you have wasted. Okay, the time of the staff that you have wasted. So it comes, all comes under transportation waste. Fuel that has wasted. Okay, so transport also within, for example, you the ward has ordered some uh, sterilized articles from CSSD. Once the article has reached the ward, they send it back, no longer required. Okay. So maybe the CSSD has put extra effort to immediately sterilize the article and give it, okay, as and when required. Okay. They may have put some other work at halt just to meet this demand. So it's wastefulness of their resources as well. Okay. That's an example of transportation. Inventory, keeping unwanted things in the inventory, keeping expired things in the inventory, machines that are obsolete, no longer required in the hospital, keeping those machines in the hospital inventory. Okay, it just consumes space. It will just sit there and consume space. Nothing else can be done. Okay, no new items can come. Okay, you will run out of a lot of space and you will have nothing more new to include in the inventory when old obsolete things are sitting there occupying the space. Okay, that is waste. Then motion waste, unnecessarily people, staff, visitors, customers, clients, patients, anyone, unnecessarily if they are moving from point A to point B, when things could have been get done just by staying at one single place. If all their work was being done, it is so efficient. Okay, you are wasting the time and energy and resources of the staff when they are leaving their desk, going somewhere to get a work done, come back to the desk. Okay, keep the patient waiting and all. So instead of that, just by being on their desk, majority of the patient's work is done. Okay, it is more efficient. So that is motion waste. And extra processing, collecting too much information, unnecessary information, having too much of data which you don't know what to do of, that is extra processing. The principles of lean model: define value. Whenever you are doing a lean project, you should know what is the value, what value for the customer. Okay, always remember value here. What your customer feels is valuable, okay, to the process is what should be valuable to the process. Okay, then map valued stream, which means put a cost, put a budget, okay, a quantitative numerical value to every step in the process. Okay, it could be admission process, discharge process. Step by step, each step will have a value to it, how much value it is adding to the patient. Okay, so put that numerical value to it. Create a workflow, or any process map, workflow map. Okay, establish a pull system, pulling more patients in, pulling more visitors in, pulling more efficiency in, and pursue for perfection. Even if you attain it or don't attain it, but you have to still keep pursuing for perfection. So these all are the five lean principles. So that's all for today.